Thank you all for joining us today for the New Mexico Aging and Long-Term Services Department State Plan on Aging public hearing. My name is Courtney Hoskins, and will be serving as the moderator for today's public hearing. First, we're going to go through some housekeeping items. I wanted to let you know that there is closed captioning at the bottom of the screen, but sometimes it may not capture precisely what is being said. This is one of the reasons why we're recording the hearing today. I also want to let you know that if you need interpretation during the PowerPoint presentation, please pay attention to the closed captioning at the bottom of your screen. I also want to let you know that if you require sign language interpreters, they're available in a Zoom window, except during the PowerPoint presentation. Finally, today, we will not be answering any questions you may have about the state plan. The purpose of today's public hearing is to hear from you and listen to what you have to say about the state plan. But before we open it up for comments, I have the honor of introducing Katrina Hotram Lopez, who is the Secretary for Aging and Long-Term Services Department. Secretary Hotram Lopez, thank you so much for being here today, and I turn the time over to you now.
Thank you so much. It's such an honor and a pleasure to be here. So as stated, I am Katrina Hotram Lopez, the Cabinet Secretary for Aging and Long-Term Services. I just really appreciate everyone joining us today for our public hearing and presentation of our state plan. I want to start off by thanking my team, led by Denise King, our Aging Network Director, for all of their hard work on this. Making projections into the future can always be a challenge, but this was an exceptional year. Not only did Denise and her team have to navigate and pivot daily during this pandemic, but they also needed to try and forecast needs, expansions, and the opportunities to make long-term plans for the future. Thank you so much, team, for all that you've done, your dedication to the seniors, and for your thoughtfulness that you've invested in this plan. And to everyone attending today, from the bottom of my heart, thank you. We appreciate you joining. Thank you for taking interest in our department, and thank you in advance for providing comments. It's absolutely vital that we hear back from our bosses and key stakeholders, all of you, the taxpayers, through this process. We serve New Mexicans, and their voices and their ideas and opinions are what should be featured as a critical piece of this plan. And that's what we want to do today. So what is the point of the public hearing? This is a requirement within the Older Americans Act to hear from people that plan the services. Whether or not that's you or someone you care for or your loved ones, we want to hear from you. Every 4 years, the State Unit on Aging is required to submit a new state plan to the Administration for Community Living. This state plan will cover the time frame from October 1st, 2021 to September 30th, 2025. Hopefully, you've seen that we have 2 live virtual public hearings planned. We did this so that we could maintain social distancing, keep our residents and community safe, and allow access for comments from people and organizations across the state. Ideally, in the future, state plan hearings will be a hybrid of in-person and virtual hearing. This hearing is one of 2. Coming up next, there will be a high-level overview presentation of the state plan to give the Cliff Notes version of the state plan. The remainder of this time will be spent with us listening and documenting public comment. A lot of this plan includes the visions for the department, how we can adopt, innovate, and better serve our stakeholders. As states' infrastructure resource, networks of service and support systems can play a critical role in not only the longevity of its own residents and citizens, but attracting people to relocate. In New Mexico, our senior population is seeing a steady rise. By 2030, our land of enchantment is expected to have the 4th largest senior population state per capita in the nation. With that in mind, and with the rise in services and supports throughout this pandemic, we put this state plan together for the next 4 years. We have a multitude of areas where we're envisioning growth. We want to continue to achieve our overreaching and overarching purposes of assisting older adults and their caregivers to maintain independence and live safely and autonomously, as well as the guiding principles of protecting the safety and rights of those we serve, to promote personal choice and self-determination, treat all persons with respect, embrace cultural diversity, encourage collaborative partnerships, and provide fiscally responsible services. We must modernize ALTSD, which requires a multifaceted, innovative approach that supports successful outcomes, including access to more timely data making it easier for us to implement performance measures and provide the ability to make logical decisions. It is critical that we embrace change. If we look at our population data, it shows that we are aging. We're an aging state with approximately 513,276 individuals 60 years and older. ALTSD and the network of service providers need to be equipped to meet the growing needs of our older adults. We know there are different challenges being faced by our senior living and in rural locations, which can include infrastructure limitations, just desperate populations, and long travel distances, and demographic and economic trends. All of these can make the provision of services challenging. We need to continue to expand ways and points of connection for our seniors, especially those in rural communities that are lacking support. I'm going to read you an extract from a quote from the state plan that I feel like really highlights our objectives. Here we go. We are strongly committed to ensuring that the services provided by New Mexico's aging network meet the needs expressed by older New Mexicans and are supported by data. These needs include isolation, nutrition, transportation, health, employment, community engagement, safety, self-direction, and legal services. In addition to these services provided to address these needs, New Mexico plans to provide support to caregivers with education and respite. Service providers will be supported with business acumen training and the opportunities to access Medicare and Medicaid funding. Finally, New Mexico plans to transform systems of care by fully including the tribes, pueblos, and nations within New Mexico in all funding opportunities for state and federal funds, as well as working to integrate the aging network services with a broader healthcare system, including access to Medicare and Medicaid funding. I would be remiss if I didn't include another kudos to my staff here. A big thank you to our Aging and Disability Resource Center. They have pivoted and accepted loads of additional duties during this pandemic. We've seen massive increase in additional calls to our ADRC, and we're so happy to be connected with them and that they've connected to more New Mexicans who can benefit from services. This year, they did all of our Medicare registration and application over the phone, and we saw nearly a 500% increase in calls. You guys are amazing. Thank you, thank you, thank you. I could go on and brag about my team all day. We're relatively a small department, but we are mighty, and I'm so proud. I would also like to remind everyone that this is older Americans Month, as well as Mental Health Awareness Month. And to that, I have a big shout out to one of our greatest partners, Bernalillo County. Thank you for all you're doing, not only for behavioral health and mental health, but paying special and close attention to our seniors who are affected not only by this pandemic, but who are affected in your community. Thank you again for joining us today. I look forward to hearing your comments. Courtney, I'm going to hand it back over to you before I jump in on another passionate soapbox. So thank you so much for moderating today and keeping us all organized and on time. We couldn't do this without you. Courtney?
Katrina, thank you so much. I now have the pleasure of introducing to you Denise King, who is the Aging Network Division Director at ALTSD. Denise is going to share with you a high-level overview of the State Plan on Aging through a PowerPoint presentation. Thank you so much, Denise.
Thank you, Courtney.
Hello, and welcome to the New Mexico Aging and Long-Term Services Department State Plan Public Hearing. This session is an overview of the State Unit on Aging State Plan for federal fiscal year period starting October 1st of 2021 to September 30th of 2025. This slide demonstrates the requirements for the state plans by the Administration for Community Living through the Older Americans Act. Originally passed in 1965, the Older Americans Act creates funding provisions for the State Unit on Aging to support services. The Aging and Long-Term Services Department is the designated State Unit on Aging for New Mexico and has the responsibility to plan and oversee the Older Americans Act services. One of the purposes of the Older Americans Act is to encourage and assist states and local agencies in the development of the comprehensive and coordinated in-home and community-based long-term services for older adults, age 60 and older. As you review the state plan, note that there are requirements that make up the plan. The signed verification of intent by the state, a narrative section which includes 1, the executive summary section, 2, the context section, which sets the stage for our state plan and identifies the needs of the older adults and adults with disabilities in New Mexico. 3, the goals section, which includes objectives, strategies, and outcomes to those set goals. And 4, the quality management section, which includes the measure in place to monitor the services delivered to the aging population. The state plan also includes sections addressing the Interstate Funding formula, which is included as an attachment along with many supporting documents required and used as a resource in the development of the state plan. Assessing the needs of older adults and adults with disabilities is a requirement for the state plan and is a value of the Aging and Long-Term Services Department and that of the Older Americans Act. The needs assessment conducted by the University of New Mexico and the National Resource Center on Native American Aging identified the needs of New Mexico's older adults and adults with disabilities to have an increase in access to the quality and a variety of food, expanding transportation services, an increase in legal services, and augment services for grandparents raising grandchildren. Using this pertinent data allows the department as the state unit on aging to tailor contracted services to meet the needs of our consumers. In the state plan, the listed goals, objectives, and strategies are measured by the State Unit on Aging, setting performance measures that can be supported by the data collected and setting specific deadlines. The goals are visionary statements that describe the strategic direction that the state is moving in. The objectives needs to be attainable, specific, and measurable. The strategies outline how the state will achieve the goals and objectives. The outcomes document the measurable benefit to the older adults. The 4 goals targeted for the next 4 years include: 1, fulfill mandate as the State Unit on Aging to effectively administer the Older Americans Act Title III core services in partnership with the area agencies on aging and other network providers, with the goal to enable older New Mexicans to remain in their residence and community of choice, with support and access to high-quality home and community services. 2, expand and innovate services provided with ACL's discretionary grants. 3, establishing and expanding innovative programs that support consumer control and choice. And 4, prevent and improve responses to abuse, neglect, and exploitation. In this next slide, we will highlight on a few objectives listed under each goal. Objective 1.1, modernize Aging and Long-Term Services Department's rules, policies, procedures, and business practices to administer more effectively the Older Americans Act programs, which includes state-funded services. Objective 1.3, for Title IIIB transportation and assisted transportation services, expanding transportation availability in rural communities across the state. Objective 1.12, which includes the area agencies on aging, expanding the Title III services to the New Mexico tribes and pueblos by contracting with the Title VI programs. For goal number 2, objective 2.1 includes the Senior Medicare Patrol Program, expanding education and outreach efforts to senior centers and the Aging Network to help prevent healthcare fraud. Objective 2.5 includes raising awareness and expanding dementia resources to support caregivers and expanding dementia advocacy across the state's diverse cultures and locations. For goal number 3, objective 3.1, expand the number of veterans served through the Veterans Direct Care Program. And objective 3.2, to explore voucher programs for services funded by the Older Americans Act. And for goal number 4, objective 4.1, to enhance the quality of training available on abuse, neglect, and exploitation. Objective 4.2, to reduce the percentage of repeat investigations. Objective 4.3, to determine the recidivism rate and referrals received by adult protective services. And objective 4.5, to expand the number of regional coordinated programs for the 8 regions of New Mexico. At this time, we will highlight on a few of the strategies within the state plan. Under goal number 1, updating policies and procedures to allow for implementation of innovative approaches to service delivery, which includes alternative models for transportation and schedules for home delivered meals. Under goal number 2, recruit and train volunteer counselors for the Medicare peer-to-peer presentations and outreach. Also, conduct outreach to educate beneficiaries on healthcare billing errors and deceptive healthcare practices or fraud. Under goal number 3, establish a team in the Veterans Direct Care to keep momentum and progress to meet goals, and partner with state and federal Veterans Services programming to promote the Veterans Direct Care program and survey consumers. Under goal number 4, provide training to Adult Protective Services staff on underserved populations. Also, decrease recidivism rate by 5%, and provide and track continued case management and community support services upon the closure of an Adult Protective Services case. This slide notes a few of the performance measures in the state plan by goal. Goal number 1, maximize billing opportunities for Medicaid services by working with the MCOs, including case management. Goal number 2, produce an annual summary of the impact of Alzheimer's disease and related dementias in New Mexico. Goal number 3, expand the number of veterans served, which includes 25 new veterans into the program each year. Under goal number 4, provide training on the underserved population in New Mexico to the Adult Protective Services staff at least once a year. Quality management is a requirement in the submission of the estate plan. Monitoring, oversight, and remediation is necessary to ensure that New Mexico older adults and adults with disabilities are receiving high quality and the intended service. The goals of the State Unit on Aging continues to be data standardization, program evaluation and outcome measurements. The strategies are to implement the area plan guidance, streamline paperless submission process, timely and accurate data collection, updating data collection methods and models, aligning efforts with strategic planning and reporting, while ensuring continuous improvement process. Compliance and consistency moves us forward. The Older Americans Act programs are administered through federal, state, and local partnerships, from the Federal Administration for Community Living to the State Unit on Aging and through the local area agencies on aging. The Administration for Community Living requires that the State Unit on Aging includes the Interstate Funding formula in the state plan. The Interstate Funding formula has to meet statutory requirements and demonstrates how the Older Americans Act funding will be used on senior services. The Interstate Funding formula changes require the approval from the Health and Human Services Assistant Secretary to create and implement a formula that distributes resources solely on the population characteristics for each planning and service area and reflects changes in the characteristics among the planning and service area by incorporating updated data. The Interstate Funding formula factors include the senior population 60 plus by planning service area, the senior population for that planning service area, total senior residents in rural areas, the senior population poverty rate, and the senior minority rate, using the U.S. Census Bureau data. To summarize, the comprehensive state plan includes the 12 Administration for Community Living requirements, which encompasses the 4 targeted needs of the New Mexico older adults and adults with disabilities, the 4 goals focused on overarching Older Americans Act service delivery with 35 objectives and 104 strategies to meet the 89 performance measures outcomes. Cooperation, coordination, and partnership equals success, and keeping New Mexico's older adults and adults with disabilities safe, providing a high-quality service, giving them the ability to age in place in their own residence of choice, and reaching those most in need. In the state plan, there are key objectives and strategies to implement modernizing services and business practices. For example, exploring vouchers for nutrition services and transportation, using a web-based application and platform to collect data accurately and in a timely manner, an on-demand application found on the department website, collaboration with interdepartment and interagencies to focus on senior needs, program improvement, and older adults and adults with disabilities social determinants of health, a business acumen model, community health workers and peer support workers, leveraging Medicaid funding, collaborating with tribal service providers, and virtual outreach and education. We welcome your public comment. You can make public comment by raising your hand during the public comment portion of today's hearing. Please be patient. The moderator will identify you by name or the last 4 digits of your phone number. Please be patient as they will go through the list of raised hands in this virtual public hearing session. You can also leave public comment by calling 833-485-1332. You can leave a voice message with your public comment. You could also respond to a survey linked in the notification of today's public hearing. Or you can mail or email your public comment to the email and address on the public hearing notification. Thank you. This public hearing is being recorded and can be later viewed on the website at www.nmaging.state.nm.us.
Denise, thank you so much. Before we get to the most important part of our time together, which is hearing from you, the participants, our stakeholders, we would like to remind you of a few housekeeping items. First, as Secretary Hotram Lopez stated, we are holding 2 public hearings virtually so that we will be able to maintain social distancing and allow greater access for comment from people and organizations across the state than if we were to hold 2 public hearings in person. We appreciate your patience with us, especially if we experience any challenges due to technology. Second, as Denise has indicated, we want you to know that the public hearing is being recorded, and we will be submitting the comments as part of our state plan to the Administration for Community Living. Third, we will not be answering questions today that you may have about the public hearing. The purpose of our time today is to hear from you and listen to what you have to say about the state plan. So let's get started. So, as it was stated in the PowerPoint presentation, if you would like to provide comments, you will have 2 minutes to do so. When it's your turn to provide comments, we will be asking that you state and spell your name, tell us where you're from, and if you're representing an organization or agency. After that, you will have 2 minutes to provide your comment. At the 2-minute mark, a sound will play indicating that you have a few seconds to finish up. This is what the sound is like. I don't know if you're able to hear that. I will turn the volume up a little. If you're joining us through Zoom, please raise your hand, and when your name is called, click unmute. If you would like to provide comments and if you have called in by telephone, you can press the *9 button to raise your hand. And then when the last 4 digits of your phone number is called, please press *6 to unmute your line. So I'll give everybody a minute to decide if they want to provide public comment today. And like I said, if you're on Zoom, just simply raise your hand. And if you're a call-in user, you can press *9 to raise your hand.
Courtney, we have one raised hand. Give me one moment. And we have Carol Ryan.
Hi, Cheryl. If you would like to unmute or Denise is working on unmuting your line.
Okay, I've hit unmute, so I'm hoping you can hear me. I didn't see anything in the presentation about housing and especially HOA housing. A lot of senior citizens choose to live in HOA housing because they don't have to worry about taking care of the exterior of their buildings or the, grounds, lawn mowing, any of that sort of thing. Are you going to be able to address that at all?
Cheryl, thank you so much for your comment. We have documented the comment and we will make sure that that is taken under consideration. Thank you so much.
Thank you.
So when we have other attendees speaking, if you would like to provide public comment, again, please raise your hand if you're on Zoom. And when you unmute your line, if you could state your name and spelling your name for us and letting us know if you're with an organization, and then you'll have 2 minutes to be able to provide your comment. And if you're on the telephone and would like to provide public comment, please press *9 and that will raise your hand. And then when the last 4 digits of your phone number is mentioned, you can press *6 to unmute your line. It looks like Denise Dawn Armstrong would like to provide public comment. So Dawn, if you would state your name, spell your name, and let us know if you're with an organization. and then you'll have 2 minutes. Dawn, it looks like you're muted again.
How about now? Is it muted now?
Sounds great. Now, thank you so much. You have 2 minutes.
All right, so Dawn Armstrong, Armstrong. I represent New Mexico Senior Olympics, and we are doing community outreach virtually and also experience interactive learning here in Las Cruces. However, my question for you all is, or for my comment is, will there be funding for lots of different regions in New Mexico, specifically Las Cruces? I only saw on the PowerPoint that there was funding generally in the northern part of New Mexico counties. And then will there be continued funding for these such programs for the seniors? Because right now they're 12-week programs and they should end here relatively soon. But will there be a continuation for us to have programs like that in the future?
Dawn, thank you so much for your comment. We have captured that and we will make sure that that is documented. Is there anyone else that would like to provide public comment? If you are on Zoom, you can raise your hand. If you are a call-in user, you can press *9. I also want to remind everyone that you still have time to provide public comment through the different means of calling 833-485-1332, and you can leave a message on a voicemail with your public comment. That voicemail is being checked on a very regular basis. You can also fill out the survey that was mentioned in the notification. You can email or mail your written comments to Aging and Long-Term Services Department by looking at the notification and either putting in the mail your comments or emailing those comments to New Mexico State Plan Comments at state.nm.us. And we will be having all of the public comments open until 5:00 p.m. on May 19th. After that, public comment period will be over. Does anyone else have any public comments that they would like to share with us today?
Courtney, I show that Berlinda Trujillo has comment.
Great. Berlinda, thank you so much for speaking with us today. And if I could have you state your name and let us know if you are a part of an organization and who you represent.
Good afternoon. My name is Berlinda Trujillo, Berlinda. Trujillo is pretty common. And I'd just like to advocate for prevention with these funds that will be allocated in the next few years. I believe it's really important to keep our seniors healthy and fit, preventing debilitating medical issues along with medical costs. And what we have been doing with New Mexico Senior Olympics, I am a contract employee with New Mexico Senior Olympics, and I oversee the Enhanced Fitness Program, which is a senior-based, community-based fitness program for 60 plus. We have recently been teaching or leading classes, our instructors, through virtual and remote means. And I would just like to advocate for this to continue with the new fiscal year that would be upcoming. I think it's wise use of these funds that come our way. I think if we can prevent these big issues and keep our seniors living independently at home, I think we would be using that money wisely. So just wanted to bring that to your attention.
Thank you so much. Your comments have been captured, and definitely prevention is a very important part of the work that we do here in New Mexico. Thank you for your comment. Does anyone else have any comments that they would like to provide? As I've stated before, if you have called in on the telephone and would like to provide comment, please press *9. And then when the last 4 digits of your phone number has been read, you can press *6 to unmute yourself. And then if you have joined us via Zoom, please just simply raise your hand. And when your name is called, please announce yourself and let us know if you're representing an organization. And just another reminder, if you're more comfortable providing comments in the written form, you can mail those via the post office to ALTSD at the address on the notification, or you can email them. If you would like to speak, but not to a group of people, you can leave a voicemail on the phone number also located on the notification. And again, we have public comment open until 5 p.m. on May 19th. Does anyone else have comments that they would like to provide?
Courtney, I show no comments yet in the attendee section.
Okay. We would love to hear comments from folks.
We have one comment with Flo Trujillo.
Hi,
Thank you so
Flo.
much. I really enjoyed the presentation and I love ALTSD. One of the things that I find that is very important is the therapeutic part behind the arts. And I like that everything is opening up again. I would like to see a lot of downloadable, available activities or projects or even signage that maybe we could use that would be available. And but mostly activities. I know that we can hit YouTube and all these other places, but it'd be kind of nice to get something very close to what we might be looking for with some new ideas that everyone could share. Thank you.
Thank you so much for your comments, Flo. Really appreciate that input. It's been documented. Does anyone else have any comments that you would like to provide? Again, if you're new to the call, if you're on Zoom, you can just simply raise your hand. And if you're a call-in user, please press *9. And then when the last 4 digits of your phone number is read, you can press *6 to unmute your line.
Courtney, at this time I show no comments, but I'd like to just remind the attendees today that this session, this public hearing is being recorded and can be accessed on our website. We urge that they share that information with adults and adults with disabilities, as well as with other organizations, so that they can have an opportunity to review the public hearing and allow them to make public comment in the ways that you've mentioned thus far.
Yes, and also a reminder, there will be another public hearing on Friday at 9 o'clock Mountain Time. And there are the other ways to be able to provide public comment too. You can call the phone number that we've listed before and leave a voicemail. You can mail your written comments to the address on the notification. You can email your comments to the email address on the notification, or you can fill out the survey that was also identified on the notification. And again, we have our comments open until 5 p.m. on May 19th. We are checking on a regular basis each of the means of public comment so that we can compile that information, and we will be submitting the comments as an attachment to the state plan to the Administration for Community Living. Does anyone have any comments? I think we'll give it a couple more minutes for folks to decide if they want to provide live recorded public comment today. Then if not, at 2:55, we'll start wrapping it up. So just want to give you the last opportunity to be able to provide comment today. If not, you probably could tell me how we have public comment open to the public at this point. But as a reminder, you can call the voicemail at 833-485-1332. And that's a voicemail that's been set up specifically to receive public comment for the State Plan on Aging. There is a survey that was mentioned on the public notification. You can fill out the survey, or you could email or mail your comments to ALTSD. As another reminder, we are having another public comment, a public hearing on Friday this week at 9 o'clock Mountain Time. And that link to the Zoom was also provided on the public notice. So one last chance, if you would like to provide live public comment, you can raise your hand, and if you're a call-in user, you can press *9 and then *6 to unmute your line. I don't see any hands raised at this time, so I want to say thank you so much from the bottom of my heart and for all of my colleagues at ALTSD for participating in the public hearing today. I now have the distinct honor to introduce to you Mr. Sam Ohinaga, the Deputy Secretary of Aging and Long-Term Services Department. Sam will be providing closing remarks today.
Thank you, Courtney. I appreciate it. I just want to say thank you all for joining us today and participating in this event. This is really very important to us. It's critical for our process for us to move forward, and we value your input. We appreciate your input. We will take everything into consideration so that we truly can serve the seniors of the state of New Mexico in the best way that we can. I know the Cabinet Secretary, Katrina Hotram Lopez, is super passionate about this. You see the excitement every day in her eyes, in her voice, in her vision. She's an amazing person, and we just want to get this right with all of your help so that we can move forward with providing the best services that we can for our seniors. And again, I just want to say thank you, all of you. Thank you to all of the staff. People have worked very hard to get to where we're at today. And I appreciate all that. And all of you that are participating today, thank you. And I can't thank you enough. Again, our comment period is open until May 19th. You can leave the voicemail like we've talked about at the phone number 833-485-1332. The survey, we appreciate if anyone wants to do the survey. The email, or like me, I use the snail mail. So we're giving everybody the opportunity. And again, and all comments will be considered as we receive them by May 19th before 5:00 p.m. Over the next month, we'll be making our final changes to the state plan. We'll integrate these suggestions and comments as appropriate. We'll then be submitting the state plan to the Administration for Community Living on July 1st, 2021 for their review and approval. The plan will then go into effect on October 1st, 2021 and will be implemented from October 1, 2021 through September 30th, 2025. So here's your opportunity. Again, on Friday, we have another open comment, public meeting, public hearing. And so we look forward to your partnership and collaboration. We appreciate it as we implement this next state plan on aging for the great state of New Mexico. So thank you so much, and thank you for joining us, and have a great rest of your day. Thank you.